Hey, good morning, guys. Scott here. Scotty's animals. Oh, that's thick and frozen. I'm about to take Gary back to the vet for his ultrasound. I got my Gary themed shirt on. Oh, look at these dots on my head from that looks kind of cool. I look very tribal. It's from the blinds, the hole in the blinds where the string goes. The guinea pig that I rescued the other day from West LA, his name is Dice. But something had happened to him is I put him in a CNC cage when he got here with a big pile of hay, and then the next morning I noticed that his eye was like kind of cloudy, and now a day later it's turning white like a cataract, but not exactly like cataract. Cataract, you see it on the back of the eye and the lens is clear. This is the outside of the lens is clouding over. I'll show you what I mean. So here's the Dice Man, and this eye's fine, but Dice Man, will you let me see the other side? Get in the light. You can see his eyes gotten cloudy, and when I looked at it, it looked like there was a little scratch and there was some hay in there. It looks really bad, but most likely this will go completely back to normal. He'll have a full recovery, but some antibiotic ointment will really help. And I gave him some CBD to ease the pain because he looked like he was squinting. We'll take care of you, Dice. I'm so sorry that this has happened because I'm pretty sure I did not notice this. I would have noticed this when we picked him up. I think he was just so excited to be in such a big hay pile that he just climbed in there and scratched his eye because maybe he's not used to having so much hay. Oh, that sucks. I will see if I can get Dr. Camphor to just take a look at him, but I'm fairly certain that some terramycin ointment will do the trick. Well, Dr. Camphor did get a chance to see Dice, and she looked at the picture I took of the eye drops that I already had, and she said either of those would be fine, and she didn't seem too concerned about his eye. Dr. Camphor explained Gary's history to the ultrasound doctor.
This was the x-ray we took a month ago, and I was just like, what the heck's going on here? Is this like a mass? And then this is the edge of the heart? So I was thinking, is this an abscess or what's going on? So we put him on chloramphenicol.
Oh, sure does come way down there, doesn't it?
Yeah, and so I
You got
thought,
the scapular
right,
image there, but this thing's way down there.
right, and it just kind of looked so weird like that. So then we rechecked x-rays after a month on chloro. His lung sounds had been harsh a month ago, and now they were improved when I auscultated him. So now it almost looks more like this is the aorta, and then this would be the heart, except then you have this little dark area here, which is what's throwing me. So is it heart and then mass, or is this all heart? Right, and so if this is all heart, that's kind of a little big.
Yeah.
So, yeah, so that's what we're trying to figure out is this a cardiomegaly and heart disease, or is this a thoracic mass?
Sure is. Echogenicity is different here and here.
Yeah.
Hard to believe that's the heart, but
It's weird, and on the VD, it wasn't very, I mean, looks like a fairly normal
yeah,
size,
it does.
and
It looks fairly normal. The aorta looks normal.
yeah, and then last time, so it's like if there was a mass, it could have been overlapping the heart.
Yeah, it could be understandable.
So, the second one.
So like this?
Yeah, just on each side.
Okay.
Because I need to be right where your hand is.
Oh, buddy.
Yep.
Look at his little
Come
shave.
right in here.
Do you want to pet his head?
Yeah, I don't
Gary, you
know.
need to hold still, otherwise this isn't going to happen.
I don't.
Just pet his head from that. There you
Hi,
go.
Gary. Does like nose scratches. Hey, Gary Bear.
We don't have to pull a quick draw on the ground, right?
No.
Help them all.
I promised him it would be annoying but painless.
It'd definitely be painless.
It
just
get
kinda-
cold.
Hopefully there's no babies in there.
No, not in the chest anyway.
Hello, my baby. Hello, my honey. Hello, my rectangle.
Sorry, friend.
This took a long time, and it was kind of a tedious procedure, and it wasn't always working perfectly. But then later on at the end, we got some really good results.
The window for these guys is like that big. Any small motions I make or large motions on the screen.
Good boy, Gary. Good boy. I got you. I'm holding your hand.
Anything interesting so far?
Not yet. I mean, the window on these guys is so tiny.
Mm-hmm.
But nothing to write home about yet.
All right.
We'll just be patient. You must be cold. Gary was incredibly still, and the doctor said that he was really one of the most well-behaved guinea pigs he'd seen. Wow, that was the heart bouncing.
And that's the aortic velocity across the valve. Should be between 0.8 and 1.2 meters per second. Measure and see.
That's a pretty hip heartbeat you got there, Gary. Looks like a beat you could dance to.
It's regular, which is nice.
That's good.
0.876 meters per second. That is normal.
Sweet. I don't know what any of it means except for this is normal.
The flow through the valve from the left heart out the aorta is normal. There's no hypertension on the left side.
Bless your heart, Gary.
And I can check his heart rate, which is about 199 beats per minute, which is about right.
Wow.
About 200 beats per minute.
Guinea pigs' hearts beat fast.
And that's the liver right there.
Hold on, Gary.
Hold on.
Good boy, buddy.
Hold on, Gary. Hold on.
This procedure took 3 people. 1 vet tech to hold Gary, the doctor to perform the procedure, and me just to keep Gary calm and hold his hand.
Fibrosis, or is that some scarring in the lung tissues? I think that's probably from pneumonia. But there's no apparent mass.
Would there be anything you do with scarred lung tissue?
No, you just let the body try and slowly over time take care of that. Keep him on antibiotics.
He did do a course for a month.
Yeah, and that may be all he needs if he's doing well clinically.
Yeah.
I don't see a mass.
That's a bonus.
That is a bonus.
We were just hoping to see the heart, so get a picture of the lungs and a little bit of evidence of something.
And that's a mitral valve right there.
Hold on.
There it goes.
And then he moves just as I
Yeah.
want to show you.
We saw it.
Sure it is. There's a mitral valve.
It's amazing.
Right there. All right, Gary.
All done?
Is that it?
We're done. Let's get the goo off of him.
Gary! Let me see this shaved chest here. Oh, buddy. You're so smooth. You're so smooth. I'm gonna tickle you later. Dad.
Well, I'll take them all back, okay?
Okay. Dr. Camphor explains it all to me, and we come up with a plan.
So he did seem to improve on the month of antibiotics, so maybe he did have a little pneumonia. He did have a kind of a little scarred up area of his lungs. If he continues to have episodes, we could consider maybe some inhaled antibiotics, anti-inflammatories like Metacam. I don't know, some people have had...
As like maintenance, or to
Right.
try to get this under control, or...
As maintenance, because it depends on how often he's having signs, because he only had like the one episode, I think you said, in the past month. and then he had
Yes.
like a couple
Yes.
episodes before that.
Yes.
I would say to note how often he's having these episodes.
Yeah.
If it's frequent or getting more frequent, then we'll definitely want to treat him. You know, if it just goes away on its own, maybe again just a little, you know, because maybe he's got some scarring on that left lung. But the good news is he does not have heart disease, does not have cancer. Okay? Now, could he develop heart disease in 3
Sure.
to 6 months? You know, they can do
Sure.
that.
Well, I mean,
Yes, or have another episode of pneumonia. We'll have to see how he's doing, and then we'll decide, do we do another course of oral antibiotics? Do we do inhaled antibiotics? Is it so infrequent that we just will monitor it? So that kind of a thing. And probably because he did sound a little congested last time, is, you know, get him back in for a recheck exam in a few months. Yeah.
Cool.
All right, cool.
Awesome.
Thanks.
Thank you,
Good.
Dr.
Yeah,
Kemper.
good news.
Woo, woo, woo.
Yes, yes, I'm good.
Hey guys, we made it back, and as you saw, I'm happy to report that Gary does not need any further treatment. We're going to check back in with Dr. Camphor in a couple months, unless he shows any new symptoms. But as far as little Dice here, you know, what I thought was funny is I named him Dice because there was no dice that he was going to be able to get into the rescue. But look, coincidentally, he has these 2 spots as if he was a little single die. So I can't believe how funny and coincidental that is. But as far as his eye is concerned, Dr. Camphor said that any of the eye drops that I have on hand they're antibiotic eye drops that I've had previously prescribed to her, she said that either of those would be fine. So I'm going to be giving him 1 drop twice a day. Just for a couple days until, or maybe a week, until this goes back to normal. So I'll keep you posted on that. This is Little Dice. He is now my 1, 2, 3, 4, 5, 6th foster right now, but hopefully these guys can get into the rescue soon. And I spent a lot of time bonding with this guy today. If you've checked my Instagram out, check my Instagram out. You'll see his cute picture. We were in the waiting room reading guinea pig books. Okay, so that's it. What an emotional roller coaster day, you guys. But you've been with me this whole time. As far as the whole t-shirt fiasco goes, I think it's sorted out. So if you wanted to get one of these shirts, not only in support, but in celebration now of Gary's wellness, Gary's clean bill of health, then this is the heather, the dark heather. It's just kind of a softer, more comfortable, and I wear a small because someone once told me if it doesn't fit perfectly, it's a disaster. All right, that's it. I gotta go. The bird's gotta go to sleep, or he's gonna get mad. All right, guys. See you next time.